Hi again everyone, it's Jasmine Buan and I am back again at CSA Medical Aesthetics for another treatment. So for today, I'll be having 2 treatments to reduce my pores and prevent any acne growth. As you might remember, I was already featured in 2 videos before. Yung isa, I had already done a Korean nose and then the other one was a Korean glass skin procedure. So ngayon, as you can see, medyo wala na yung pimples ko and yung nose ko, ayan, nandyan pa rin naman. I want to focus sa pores ko muna since medyo malaki siya ng onte. Kaya I want to reduce it minimally as possible. Following treatment would be for my acne. Kasi nag-reduce naman na yung pimples ko, wala na ako masyadong active pimples, but there are some marks and occasionally dahil nga sa hormones, babae, may mga nag-grow na plate na pimples. So as explained by Doc Contessa, this treatment would prevent any acne growth that I may have. Click the subscribe button and hit the notification bell to keep you posted.
Good day everyone, welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a topic called acne prevention using Incobotulinum Toxin type A. And we have with us again, she was a guest before, let's all welcome Miss Jasmine Buan.
Hi guys! Hi Doc!
Hi! Welcome back, Jas.
Thank you po.
Okay, so if you recall, Jas had a treatment, the so-called non-surgical nose lifting, and that was last year, and we can still see the effect of that procedure, right, Jas? So there is still a very good nasofrontal angle, so the profile, the nose, well, it's still there. And it is still within the right dimensions and proportions. And also the nasal tip, I could say it is still narrow, right? So, medyo matagal na rin, right, Jas?
Yes.
Yes. And then, after that, we also did acne management for Jas. So, we were able to control the active acne formation, okay? Because we know that Jas has a history of the hormonal imbalance too, right? So we were able to control the acne formation. She had a management, she had a treatment with us. We even used some lucid laser treatment, right? If you recall.
And then the Korean glass skin
And
treatment.
also our Korean glass skin treatment. So up to now, I can still see the glow. And just doesn't have any makeup. So walang ano yan, walang mga foundation. So talagang bare skin talaga siya. So, in today's episode, we wanted to do a treatment that will prevent the recurrence of acne. Of course, we still experience the acne problem. Especially nowadays, we have this so-called maskne, right? From the constant use of our face mask. So, we wanted to do a treatment that will again control sebum production as well as help in minimization of the pores. Okay? Because for Jas, we noticed na she has open large pores, particularly on the cheek area. Right, Jas? Yan. And we wanted also to do some so-called skin lifting and skin tightening. Actually, we did already an episode on this one, and we followed up with the client. Actually, she reported to me that there was really a great improvement. because her condition was the PCOS. So for females who have a problem on like hormonal imbalance, PCOS, this is also a very good alternative for the acne control, acne prevention. Okay, so for just today, we will be targeting particularly areas with oiliness. So we know that the T-zone area is well known for having too much of oil production. Right, Jas?
Yes.
So actually, I'll be treating the forehead region. And then for the other women, they have the so-called U-zone acne formation. So we'll also be treating the U-zone region and also the anterior cheek area. Okay, so those will be the target treatment areas for the injection of our Incobotulinum toxin type A. Excited ako, Jazz! It's another procedure for you. I'm so happy really for Jazz kasi na-maintain niya yung skin condition niya. But of course, she would still come back to me and still consult, Doc, meron konting-konting lumalabas like the forehead region. We know naman, the forehead talaga, maraming sebaceous glands. So we wanted, of course, to still, of course, maintain natin. Kasi yung mga sebocytes na yan, buhay yan. Active na active yan, right? So we wanted to do a control, a prevention, and we have our medicine that we're gonna use for that main purpose. So, I'm so excited ating ipakita ang actual procedure sa pagbabalik ng CSA Medical Aesthetics. Back. So we're now doing the procedure so-called microdermal injection of the Incobotulinum toxin type A. Okay, or they call it microtoxin intradermal injection. Okay, so we did an assessment a while ago, and then right now we'll be doing the so-called markings for our injection points. So on the forehead region, so we wanted to reduce the oiliness here. We'll be applying about 2 units of our Incobotulinum toxin type A. So we'll be doing the markings. Okay, so we'll do like 5 injection points here on the superior border and another 5 injection points here on the inferior border. And for every point, we will be injecting 0.2 unit. Now, for the anterior cheek portion or the anteromedial cheek portion, we'll be giving like 5 units here and 5 units here. So we'll make again our markings. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Same thing on the other side. So we're targeting this region to help minimize the size of the pores. Because I noticed for Jasmine that on her cheek region, we can see large pores here. Now on the lateral aspect of our face or the lateral cheek region, we'll be using 10 units for each side. So we'll make a marking here, 1, 2 here. So we'll make a linear marking like that. So the first column, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Second column, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So we'll be using like 0.5 unit for that or for every injection point. Same thing here. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. So we'll also be treating the lower third of the face. So the mandibular region, we'll be using 20 units here, 20 units there. So for our marker, so we can use 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. And then on the opposite side, 2, 3, 4, 5. So if you can see the areas that we're targeting, this is like a U-zone region. Actually, it's common also among women, especially those with hormonal imbalances. So they have the U-zone problem of acne formation. Okay, on the chin region, you can also make 2 injection points. So now we're done with the marking. So a while ago, we did cleansing already. So of course, we have to sterilize everything here. And then after that, we also apply the topical cream to numb the skin since we will be injecting. And then we did an assessment, and right now will be of course, after the markings, it will be the injection procedure already. So again, the technique that I will be doing is the so-called microtoxin intradermal injection technique. So take note, it's in the dermis, intradermal region. Okay, that's the anatomical plane that we will be injecting. And then I prepared a product which is Incobotulinum toxin type A. And I did a so-called hyperdilution of the product since we're doing like a intradermal injection, so we have to make the dilution more for our product, okay, because we're injecting into the dermis layer. So we'll be using our first syringe here. So I'm using an insulin syringe here. I'll be starting on the forehead section. A while ago, I was assessing also the forehead region of Jazz, and I told her I noticed already beginning lines on the forehead. Right, Jazz?
Yes.
So, early signs of aging. Tama. So here I said that I'll be using 2 units. And I have like a 6-unit medicine here. So I'll just be injecting a total of 2 units. Now for every injection point, it will be 0.2 units. So this is just an intradermal, and your syringe should be like in a 15-degree angle. So just a tiny bleb there, small bleb only. So we wanted only small dose. So I noticed some tiny, or the comedones on the forehead section. Are you okay, Jazz? Yeah. Because we did apply topical lidocaine. Because a lot of people are asking, masakit po ba? Yun ang first question. So this is just a simple technique. It's just an intradermal. You make a tiny bleb there. Okay. So I did already the superior border. I'll proceed to the inferior border of the forehead. So take note again, I'm intradermal. So I'm not going into the deeper muscle, which is the frontalis muscle. So the goal here is to reduce the sebum production. Right, Jazz? Of course, we're hoping that a few of these units will diffuse into the muscle because I noticed already wrinkle. So we don't want to actually hear that. But we can prevent it. So somehow we're able to prevent that already. Okay, I'm done with my 2 unit for the forehead treatment. Okay, the next one, so I want to target the anteromedial cheek. So I notice pores here. So I think we have a picture showing yung mga large size pores sa anterior cheek ni Jazz. Then hopefully after this, we can see an immediate effect, because there were reports that after injecting this botulinum toxin into the dermis for the management of our open pores, they were reporting that they see an immediate result already. So now, I mentioned a while ago I'll be using 5 units here. Now for 5 units, I need like a 0.5 unit for every injection point. So I think I'll be needing the other syringe. Proceeding to the right cheek region here. So I've mentioned that I'll be using a 0.5 unit for every injection point. So I'll be doing the first row here. So a 0.5 here. It's just going to be again intradermal. We wanted to create a tiny bleb there. So with a tiny bleb, creating that blanching effect on the skin. So I really noticed the open pores here on the cheek region of Jazz. Okay, sponge please. And actually a while ago, Jazz and I were discussing because she noticed that she has some hair follicles on this aspect of the cheek, right, Jazz?
Yes.
Some tiny hair growing.
Yes.
So she's seeing some hair follicles now on this medial aspect of her cheek. And we were discussing that, well, I haven't really seen a study saying that it can like stop growth of hair follicles here, but I only was able to see one like a document there saying that it inhibits the erector pili muscle, which is actually connected also to the strand of the hair shaft. So it could be related to that. If it inhibits the erector pili muscle somehow, probably it will also control the hair follicle there, right? Because it will tighten the skin, it can close the pores. So somehow we'll see, we'll inspect if there will be like a reduction of the hair follicle there. So we're doing like a study here too. Okay, so everything should be scientific, everything should be evidence-based. Okay, so we're proceeding. So again, I'm injecting into the anteromedial cheek, intradermal only, and I want to give like a 0.5 unit here, 0.5 unit on the second row here, inferior to that. So this is an easy technique actually, and it's very safe, and there were studies done on this, so we're not afraid of this botulinum toxin diffusing into the zygomatic major and minor muscles. We know that those muscles are responsible for smiling, so we still want just to smile. That's why I want to remind again each and everyone to just go to medical doctors who are trained to do aesthetic procedures like this, because we know the anatomy of the face and we know the physiology and biochemistry of our of course our face, as well as the product that we're using. We know the biochemical components as well as the mechanism of action of this one. So for the safety of everyone, you just go to your doctor. So that's a very clear reminder. It doesn't mean that those people who are not doctors and they were claiming, oh, I have a certificate of seminar, still that is not a license to perform procedures like this. I really recommend that you can do your studies, go into School of Medicine. It's a 4-year course that you can enroll, and then after that, if you pass the board exam, then you have your license and you can do these procedures. So we're proceeding to the mandibular aspect. So we're using like a total of a 20 unit here. And then for every point of injection, you can use your 2 unit of your Incobotulinum toxin. Type A. So we have 2 rows of 5 injection points here. There you go. So it's an easy technique. It's quick technique. And you're just in the dermis. And you are just targeting the pores as well as the sebum producing cells. And also you wanted to do skin tightening, skin lifting with the collagen synthesis, fibroblast activation, inhibition of erector pili muscle, inhibition of those alpha-nicotinic receptors, acetylcholine receptors, all those benefits from this injection of Incobotulinum toxin type A. So they were even saying that those who have redness or rosacea, it can also control that, because they were saying that it's able to control or inhibit those peptides release that can cause your redness or flushing of the skin. Those people who have this erythema condition of the skin, hypererythema, or too much of the redness or blushing, or rosacea or acne rosacea, you can add or incorporate this as your treatment too. Now for our final procedure, we'll do the chin region. So the skin only, we'll inject like 2 unit here and also a 2 unit there, and we are done. with the microdermal, or rather the microtoxin intradermal injection. We'll show the result to Jazz when CSA Medical Aesthetics return. And we're back, so we'll now show the result to Jazz. Here's our mirror, Jasmine. Yan. Alright. Although after those several injections.
Ano kagad ako, yung
the forehead. Yeah, somehow I'm
dito po
noticing
sa
improvement.
mga high points.
Yes. Yan. Yeah, kasi our goal of treatment is, of course, yung sebum control, then yung pore minimization, and skin tightening lifting. That's our target. Right? At saka yung acne prevention.
Yes,
kasi, well, yung causes ng acne formation, we've mentioned 4 pathogenetic factors. Kasama dyan yung sebum production, tapos yung hyperkeratinocytosis. The other 2, yung inflammation and yung propionibacterium or cutibacterium acne. Okay, we use other medicine for that. At least na-target natin yung 2 etiologic factors ng acne. Okay, yung sa keratinocytes, may inhibition daw itong ating botulinum toxin type A. Tapos yun nga, yung sa sebum control. So, we're targeting those 2 causes of acne formation. So, we can use this kind of treatment for prevention or control of acne. So, for our patients who really have this problem of on and off acne or breakouts, this is an alternative. Kasi others are already using a lot of remedies, yung mga topicals, may iba na nag-oral, the others don't want to take the oral anymore. Tapos, we even have lasers, siyempre mayroong mga acne facial dyan or any other devices. So if you want other alternatives, well, this one, we could try it. And it's been tested already, it's been studied. Okay, meron na tayong mga reports ng mga positive feedback from this kind of treatment. Yan, any message sa ating mga
Question ko lang,
calendar?
Doc.
Okay,
Gano'n
question.
katagal yung effect nito?
Yeah, I mentioned a while ago that when we do this kind of treatment for acne control, there's a recommendation of repeating it in 3 months' time. Okay? With the intramuscular injection ng Botox or botulinum toxin for the wrinkles, we say that 4 to 6 months eh. This one, we could say like in 2 to 3 months' time. Okay? Kasi we hyperdiluted the medicine and we targeted the dermis layer. Whereby, of course, dun sa dermis natin, marami ng ano dyan, absorption dyan. And then, natitrigger din pala yung mga fibroblast cells para mag-synthesize ng mga bagong collagen and other mga extracellular matrix there. So, marami din siyang mga benefits aside from dun sa mga na-mention ko na. And the others kasi yung mga anti-aging, yung skin lifting, skin tightening, they can do this also. Like, every 3 months you can do it. So, in a year, parang ilang beses yun in a year kung every 3 months. 4 times, pwede na. Okay. Although for some cases, we do it lang twice a year. Pwede rin naman, case-to-case basis. Kasi yung mga iba, mild lang naman. So, if just a mild, like repeat in 6 months time. Pero kung yung mga talagang medyo may severe problem, kasi may iba-iba rin yung scale ng degree ng severity ng acne. So, it will depend again.
Ang bilis mag-effect po sa akin. Like
Yeah.
yung skin booster.
Right,
One
yung
session
before.
lang po.
Yes, that skin booster also you can maintain with it because they are mga booster na mayroong laman na mga micronutrients or peptides that will help in, of course, regenerating your skin, restoring the health and radiance of our skin. So, ang daming mga benefits that we are able to discuss just for this kind of treatment lang, right? And it's safe. Importante kasi dyan yung safety. At saka the others naman tinatanong kung masakit ba. Of course, you feel some of those tiny needles, right? But then with the help of the topical anesthesia, it will minimize the sensation of the tiny needles. The others naman, I have patients na kahit nag-i-inject ako sa skin nila, they're good, they're okay, they're fine with it. And of course, ano yan eh, sabi nga nila, ano yun, it hurts to be beautiful ba? Or no pain, no beauty, no pain, no gain. Okay, kayang-kaya naman yan, we can do it naman, right? Any other question?
Wala naman po. I just want to say, sobrang worth it ng ano talaga ng pain. Yung benefits outweigh the pain.
Exactly. And we're happy with the improvement na nakikita natin kay Jazz. Kasi when we started talaga, si Jazz before nung nag-message ka sa akin, I feel yung mensahe mo sa akin na, Doc, itong acne ko, like it's been on and off, and I've tried a lot of things, okay? And then, syempre, may impact sa ano mo yan eh. Self-esteem, sa confidence mo.
Quality of life po talaga.
Yes. So, ito naman yung, of course, yung added benefit na nito, it boosts your confidence, yung self-esteem mo.
Sobra po.
Right. Quality of life? Okay din. Ano
Quality
yung
of
say
life
quality of
talaga.
life? Ano yan? Pati relationship?
Yes, kahit sa friendship.
Really? Oh, yeah.
Sa picture kasi parang medyo conscious ka. Ngayon talaga, bahala ka dyan picture.
Oh, diba? Oh, that's wonderful. I'm so happy to hear that. Ayan, kung meron po silang katanungan, you may email us at csaskinclinic@yahoo.com. We have our FB page, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Francisco G. Nepomuceno Avenue, Pulong, Malagul. Angeles City, contact number 0933-860-9193 or 0917-504-4268. If you want to see the other episodes where we featured also Miss Jasmine Buwan, you can just look at our YouTube channel, Contessa Salvador, para makita nyo yung naging journey ni Jas with us. Kung paano naging better yung skin, yung health ng skin, yung quality ng skin niya, kung gaano nag-improve talaga. Kasi here at CSA talagang, we wanted to see results Kasi you're coming to us and of course, you deserve naman yung talagang best treatment. At the same time, may outcome, may result yung ating ginagawa.
Tsaka Doc, hindi instant Kailangan talaga na mag-experiment ka din kung ano yung pwede sa'yo. So, ganun yung naging experience ko. Pero sobrang worth it naman.
Right, yeah. Kasi yan, over time, nakikita mo yung improvement. So, mas na-appreciate mo as time passes by. And of course, yung pangangalaga, it's very important. The maintenance treatment also, that's very significant. Okay? So, when it comes to natural beauty, you can trust the CSA Medical Aesthetics.